and clinical director of Maze Women's Sexual Health. I found her online. She's highly recommended. I stalked her a little bit just because I think what her message is and what she shares is just so important. And without further ado, I'm going to turn it over to you and let's do this. Also, if you do have tonight's conversation is anonymous, meaning we can't even see you and your names. If you do have questions, please type them to the panelists so you make sure that others cannot see what you're saying and what is going on. Thank you.
So let's make this a conversation, Ilana. Let's do that.
Awesome.
Maybe, but I'm going to just start a little bit by talking about Maze, because I think the way that we approach sexual functioning is a little different than other places, and it'll give you a context in which to understand the things that I'm talking about. So whereas many sex therapists will address the psychological piece alone, and OBGYNs or urologists with a man will deal with the medical pieces of things or the physiological piece of things, we really believe that those things go hand in hand. And that, at least I believe, I'll tell you, that this dichotomy between your brain and your body, it's ridiculous. It's a ridiculous dichotomy that we set up that doesn't work well for people. And that the more we can sort of marry the physiological and the emotional, psychological, communal, the better results we're going to have with our patients. And so we are, a sexual health center. We have urologists, women's specialists, women's health specialists, and therapists all on staff, and every client comes through, sees both of them. And I just feel like if all of medicine was done this way, we'd all be a lot happier. For infertility physicians, for sure. Like, I feel like to be able to separate out the medical procedures that people are going through, and then the psychological and the issues that are going on in your marriage or your relationship, or if you're by yourself or any of those things, it seems criminal to separate those things. Those things kind of need to be merged. So that is how I approach sexual issues. I feel very strongly about that. And that's kind of the framework in which I'm going to speak now. I will say that one of the big challenges for people going through infertility treatments when they have sexual issues is that it really limits the tools in our toolbox from a practical perspective, right? Like we can't use hormones because these women are often on too many hormones, already. There are other medications we can't necessarily use, but it's really valuable to kind of understand the whole picture because it gives people sort of a sense of normalcy, I think, in a way that they may not feel like otherwise. So I just wanted to give people that kind of background.
Thank you.
Was there a specific question you wanted to start with?
Yeah. So I think a lot of times, people absolutely reach out to me and talk about all sorts of things, especially since I've been open around many things.
Which I think is so amazing that you do that, Ilana, because I think
there's plenty of things that my husband does not want me to share because it relates to him and this topic. It's okay. He's upstairs putting the kids to bed.
We could just bring him down. Let's get him down.
He's the opposite of me. He's so private, but he always.
My husband too. I think that's a thing.
It's the
yin yang thing. Yep.
Works, right? But I will tell you I can share this and I do share this privately, but whatever, we're all friends. When we were first trying during that year and a half of just not knowing what was going on and struggling between us, he just wanted to make me happy in the sense we have to figure out how to get her a kid. That's what she wants. The sex part just was not working. And we ended up going to a therapist. And for him, it was is it psychological or is it physical? And I think what you said resonates so much with where we were at. Things figured their way out, but it's still it's hard. And I think I hear from clients whose husbands have low testosterone, which causes a whole other range of problems. And I'd love to hear a little bit more about that.
Okay, so let me start by saying something which I feel is really important for everybody who's listening to hear. There's no question, I'm assuming if you're here, it's probably because you're struggling with your sex life. And what I want you to hear is that I'm sure this is a really tough time, but you are not the only one struggling with your sex life. Sex lives are complicated. all through for everybody. And this is not in any way to minimize the unique struggles that people going through infertility treatment have, because I think they are unique and we can touch on those. But I think maybe it will make people feel a little less maybe crazy or damaged, because I feel like that's the worst feeling, when you feel like you are just damaged, right? Like, I just don't want to have sex. Like, my desire for sex just has disappeared. And I want to say to you, that happens for lots of people for lots of reasons. So I'll, just put out there that the data shows that monogamy is harder for women than it is for men. And we really don't acknowledge that as a society. I think that's too scary for us to acknowledge as a society. Our society really likes to believe that women do great with monogamy. It's men who are the philanderers usually. But the truth is that the studies suggest that when a man, is in a long-term relationship, his desire goes down a little, but not that much. Whereas when a woman is in a long-term relationship, the desire plummets. Now, that's even without infertility problems.
Right.
Okay, so then you toss in infertility issues, you got yourself kind of like a perfect storm. But what I think is really important, so I'm gonna sort of try to drive this point home, your sex life is an ongoing, evolving experience. It's not like we think we don't have these fantasies, these magical fantasies, but for whatever reason, I think most of us end up with these magical fantasies that during the first 6 months or a year or 2 years of relationship, the sex is hot and fun if you're lucky. For some people, it's not even that, but if it is, it's like natural. You don't think about it. You kind of want to do it. You don't have to negotiate it. And you think it's going to be like that for your whole life. And honestly, it's not that way for almost anybody who's in a long-term monogamous relationship ever. And couples are constantly struggling, and they're what I call road bumps, basically, along the way. And some of those road bumps could be really sort of large, sticky road bumps, like infertility, and that's a real one. And some of them are less large, but still, boredom, medications people go on, birth control pills, those are also hormonal, sort of everyday kinds of medications, but more complicated medications, pregnancy, some for people, post-childbirth, which is often really complicated for people. People go on, the husbands go on medications and now they're having erection problems. People will just get older and now you got perimenopause. And then you got men who are, getting older who all have erection problems. So the urologist I work with says it's not a matter of if you're going to see me, it's just a matter of when you're going to see me, right? But my thing is, you can fix all those problems. Any problem is addressable. And I'm laughing once I was speaking to a group of Einstein medical school students, and I was giving them this little spiel. And the look of horror on these young people's face was so palpable. It was like, first of all, they started laughing. And I look up and I see these, I'm like, they were like, that's the worst thing we've ever heard about Sheva, right? That is the worst thing we've ever heard. And I'm like, yes, but it's not the worst thing. Everything is fixable. And the reason I'm sharing this with all of you is because right now you are hitting a significant road bump, but it's part of a much larger life where there will be all kinds of, please God, there will be lots of road bumps. You'll be lucky because you have a full life with lots of road bumps. And what that means is that your sex life will be able to be sustained and be good if you pay attention to it. And if you sort of accept some realities around it, give up some hyper-romantic notions about it, and sort of be willing to dig deep and kind of address those things and realize that your sex life it may not be magical, but it could be good. And good is good. Good is really good. If you can have good sex for 60 years of your life, that's great. So I kind of want to start with that as a framework, because I feel like the most important thing for everybody listening is to hear is that we're going to talk about strategies, and these are strategies you may take with you for your whole life, right? This is not like, oh my God, you are stuck. You are not crazy people who are stuck in some crazy world that is, just unsolvable. You just may have it worse than some people, or worse sooner than some other people have it. So does that resonate, Ilana? Like, how do you?
Too much so. Yes. So I'm going to, that was great. Thank you. I'm going to go a little deep sense of talking about some of our clients' loss. So infertility is just one piece of what many of us are going through and experiencing, and loss of pregnancy, loss of child is something on through. So one question we have is, I associate sex with fear now as a result of infertility, loss, and all the pain I've endured because of it. How do I overcome that?
Right. So that obviously is not going to be a simple one-liner, but what I'm going to say is that when there is loss and pain, first of all, you need to give yourself time. So nothing I say is going to take that away. Like you, but I, assume that you know that. But I'm a very big believer in talking things out. And that mean talking things out with your partner, talking things out with your therapist, which I assume you have because you should have if you're going through this kind of struggle and loss. But being able to express the sadness and the part of you that feels so sad, and not trying at all to push that part aside. Because I feel like we are very quick to sort of jump on the part that feels sad and shut it down. And all that does is make that part kind of go deep and underground. And that is not helpful. So, so when I talk about sort of pain and loss, and there's pain and loss of not having the baby you expected to have, or the kind of baby you expect to have too. So that is another kind of pain and loss. And that is so important to be able to express it, and I think verbally express it. And I know people have tried different kinds of therapies, and depending on who you may be, art therapy, dance therapy, therapy that helps you engage parts of your body can often be very, very helpful for trauma. Like, we're learning more and more that trauma lives in your body, not just in your brain. And sometimes talk therapy may not be enough to kind of unlodge it from your body. So more and more, I mean, there's all different kinds of therapies that address that, EMDR, but for sure, and that's what I'm saying, dance therapy, art therapy, drama therapy, but for sure, understanding that, knowing yourself and finding the kind of help and support you need to be able to kind of get that out. Now, I do think that what happens sometimes, and here's where I think a shift in the way we think about sex and relationships is really important. People pull themselves away from their relationship in their sadness, and they end up very isolated. Like, I see that a lot with couples, like both people are grieving, or one person is grieving more than the other person, and so they retreat. They just pull away from the other person. Either it's just too painful, or they feel like the other person doesn't feel it the same way they feel it. But I would say to you, that is where you have to kind of fight the instinct to do that. And if you need help, again, with somebody, a therapist, to help you keep that together. And this is where I feel like sex becomes really, really important. We think about, and Ilana, stop me if I'm talking too quickly, because I have this like, oh my God, Sheva talks too fast thing going. So if it's too fast, just wave your hand and I'll slow down. But
I'll wave it, but you guys also tell us on this call.
Yeah, you could try to say, slow down, we think about, and this is like the chicken or egg thing, we think that we should feel like spontaneously want to have sex, feel close, feel emotionally connected, and then we're going to want to have sex. And I push back on that a little bit, and I say, why don't you think about sex as being the glue that can actually hold you together, right? That the sex is actually a critical part of keeping that relationship going. So if I have somebody coming into the office, and I have that with some of my other therapists, we'll be reviewing cases, and she'll say, she just doesn't feel like she loves him. She just doesn't feel like she's like intimately connected to him. So she doesn't want to have sex with him, right? And I will sometimes push back, because if you're living with somebody as a roommate, you're not going to feel loving and intimately connected. So sometimes the sex actually connects the two of you and makes the two of you feel like there's glue in that relationship. If you've ever seen, did you see the movie Hope Springs? It had Tommy Lee Jones and Meryl Streep. Did you see it? Okay, I highly, highly recommend this movie. It's about a couple that stopped having sex, and this is about 10 years into it, and the woman feels lonely and sad, and they go up, and she basically says, either we fix this or I'm out of here. The acting is stupendous, but I love that movie so much, but my husband was complaining, like, you can't go with me to a movie like that or Kinsey, because I'm screaming from the back, like they finally have intercourse, and I'm like, oh my God, her vagina's going to be killing her at this point. Like, anyway, but theoretically, it's a great movie because it really shows how the relationship shifts when they put the sex back in. It's not that they made the relationship better and they got the sex, but they put the sex back in and changed the tenor of the relationship. And why I think this is an important point is because those of you who are going through these treatments, there's a tendency to make sex all about the treatments, which I get you kind of have to do. So there's some reality to that. But there's also a tendency to retreat on those times when you're not having to have sex. And that's when I'd say to you, this is where you got to change your thinking. You have to change your thinking and say, let's figure out how to have sex in a way that is pleasurable for both of us. And I can get into like specifics of that.
Yeah.
But this is where having the sex is, I think, super important. And some of you are going through treatments where like the sex becomes less, if you're using donated sperm or eggs, like somehow the sex kind of gets taken out of it. And then sometimes people just feel bad about themselves and stop having sex. So what I am saying is you need to put sex on the schedule. You just need to do that. Like you have to schedule specific times to have sex.
Okay, so what does that mean? How does that look?
That means exactly what I'm saying. Like that means that the two of you pull out a calendar and you say, are we gonna have sex on Sunday nights? Are we gonna have sex on Saturday nights? Or we're gonna pick a specific.
That brings me back to timed sex. I'll tell you, that's like a trigger for me. I accidentally put one time when we were having our time sex in the very beginning of our treatments, I accidentally had friends over and they saw my calendar and it was like sex, like it was like exactly when we had to have it. But to me, that was part of what sucked the joy out and made my husband completely on edge and just like he wanted to retreat.
Totally. And what I would say is that
how do we bring the fun back to that?
That does not necessarily mean that you have to have intercourse. It does not necessarily mean, but I will say to you that if you're in a position, and look, people are in different kinds of situations. So if you're having to have sex twice a week, my saying to you, you have to put sex on the calendar is not helpful. But if you guys haven't had any kind of sex in a month, then my saying to you, you need to put sex on the calendar once a week is helpful. And I always am torn between using this analogy, but I'm going to go for it anyway. I'm using it more and more because I figured, like, what the hell? You need to think about sex like exercise. People don't like thinking it because it's so freaking unromantic when I say it. Yeah. But you know what's unromantic? Not having any sex. That's unromantic, okay? So you need to think about having sex like exercise because here's the deal. Exercise makes you feel great. You're so happy you did it after you did it. And when you figure out a way to have an exercise that you like and you enjoy and you feel good about it and you start doing it, it becomes part of your life and you're just happy that it's a part of your life. And sex is like that. Like however unromantic that is, there is something about setting up, making sure that sex is on the table and finding a way of having sex. And let's talk about, this idea of a certain kind of sex that you have to have and what not to do, what not to have it. But that means that you have sex at a certain time and both of you know, both partners know that if nothing else, they know that on Saturday night, there will be sex. Now, if you're in a place right now where you have to have intercourse 3 times a week, then I would say then the two of you should sit down with a calendar and pick a time when you're going to have non-intercourse sex, when you're going to have naked time in the bed. And that may be the two of you fooling around and having orgasms with your mouth or your hands, or that may be not even going for that orgasm, just climbing to bed and watching a movie naked together and snuggling up, right? Or giving each other really great naked massages, something that's erotic and different than what you have to do the rest of the week. So that is where I feel like, but that is really a conscious decision, the two of you together sitting with a calendar and picking out when that's going to happen. I will say there's another technique that I often will use in situations where people are getting to a point where like one person does not want to have sex and the other person is needing to have sex because they want a regular sex life. So there I will say, pick a time that you're going to have sex and the rest of the week, sex is off the table. Like that is off the table so that let's say, I'm just going to pick 2. Let's say John and Joni, right? Let's say Joni does not want to have sex and Johnny is dying because they haven't had sex in I don't know how long. So poor Joni is sitting around thinking every day goes by, oh my God, it's been 2 days since we had sex. It's 4 days since we had sex. It's 6 days. Johnny's going to kill me. I'm hiding in the shower. I'm like, right? That's what's going on. Yep. And Johnny is thinking, I want to be a good husband. I don't want to push her, but we haven't had sex in 3 days. We haven't had sex in 4 days. I'm dying. I'm never going to have sex again. Then Joni's like, I can't even kiss Johnny, because if I kiss Johnny in a nice way, Johnny's going to think, oh my God, here's my opening. I'm going in for the kill here, right? Going in for the sex, you know? So now Joni is totally pulling away, right? And Johnny's feeling like, oh my God, not only am I not having sex, but my wife's not even like touching me anymore, right? So this is where I say, you sit down, you pick Saturday night, once a week, we're going to have sex. And Joni, you're going to do that without whining and without Johnny having to, you know, woo you. You're going to negotiate it. We'll talk about that. But the rest of the week, there is no thought of sex. So that Johnny now says, okay, you know what? I love Joni and I can have sex once a week and I can be fine with that. And I also know that Joni can cuddle up naked with me in bed and kiss me. And I'm not going to assume that she wants to have sex because I understand that sex is off the table. You know, if Joni, by some miracle, wants to have sex another time a week, Joni can use her words and say, Johnny, let's have sex. But short of that,
Sure.
yeah. And my experience is that has taken the pressure off so dramatically off of couples. Now, it only works if kind of both half that couple really sticks to their deal. Because the minute Johnny sort of tries to, you know, go in on another day, Joni starts feeling like, wait, that you just broke your end of the deal and I can't kiss you passionately without thinking you're going to want to have sex. And the minute that Joni backs off and says, I don't want to have sex tonight, Johnny feels like, well, you know, that now I'm never going to have sex again for my whole life. So what I always say is, you know, Joni then, if she's a low desire partner, you know what, if you can't have sex Saturday night, you got a migraine, you just can't pull it together. You say, listen, Johnny, I'm really sorry. I can't do it tonight, but I will do it tomorrow night or some other very specific time. Again,
Right.
Doesn't sound romantic. I get that, but I'm telling you, to getting the pressure off couples, just giving expectations that are clear and, you know, not so complicated, super, super helpful. So that's one thing I want to talk about. And let's talk about the fact that at that conversation, Joni could say to Johnny, like, I cannot do intercourse again. I just can't. Like, my vagina has to be off the table for this time, right? So what else would make you feel good? You know, like oral sex, would that work? You know, how about we lie together and we both masturbate? And, you know, I know that's really feels awkward and uncomfortable, but honestly, right now it feels like it would be a lot hotter than having intercourse again, which started to feel just like baby making to me, right? So that has to do with sort of expanding our idea of what sex is. And I can go on and on and on about that. Do you want me to, or do you want me to address something else?
Talk a little bit more about masturbation. We have some questions about, you answered it a little bit, but go a little deeper, literally.
Okay. So look, I'm a big masturbation person. Like I feel like it's really hard for us to talk about it. Really,
and
really
I see, I know that some people who have registered for this call also are coming from more traditional observant Jewish homes.
Right.
I feel like already is a little bit more taboo or comes with more stuff.
So, you know, I want to be really clear. I'm not a halachic authority, right? I do a podcast, which people might be interested in, called The Joy of Text. I've been doing it for 5 years. I do it with an amazing rabbi, Rabbi Dov Linzer. I always feel like he gets the hot seat because I'm the sex therapist. I can say whatever I want, pretty much. And he then has to sort of defend things from a halachic, from a Jewish law perspective. So I know that it can be complicated, but I want to bracket that right now because I need to speak as a sex therapist here. Okay. So let's just talk about masturbating. I think, you know, when you talk about masturbating, it's such an interesting question. So there's masturbating you do all by yourself, like solo sex. You're having sex by yourself in your bed, but whatever. Then there's touching yourself with the other person. So do you call that masturbating? Like if you and your husband, let's say, are lying in bed together and you're both kind of tired, but you really want to sort of be intimate, and you start kissing and touching, and you kind of feel like, I don't really want to have intercourse, or his erection's not doing so great, and I want to pull out my vibrator and he'll use his hand, or, you know, that's mutual masturbation, and I would consider that sex, right? Like it's an activity with another person where you're trying to get mutual sexual satisfaction. So that is one way of talking about masturbation, and that's an alternative to penis and vagina intercourse. And for some people, it does take the pressure off to do it that way. It also takes the pressure off if, let's go back to Johnny and Joni. I never used those names where I think this is hysterical. It's
Totally random.
A thing, you know. I hope there's not a Johnny and Joni listening. I apologize if they are. you know, if Joni says like, it's our sex night and I'm not really feeling it, I just don't think I could like have an orgasm, even if we use whatever, your hand, your mouth, whatever. How about I just help you have an orgasm, right? I either give you a blowjob, I use my mouth, or I use my hand, or you use your own hand, and I just kiss you and stroke you and touch you. Um, that's a perfectly legitimate way to have sex as well. What isn't a perfectly legitimate way is when you lie there and act like you're doing the other person a favor. That's not a legitimate way to have sex. Just throwing that out there, okay? So you can be less involved physically, but to be present for the other person is really important. So anyway, so that is an alternative to sort of what we think of as straight sex, which is we think of as intercourse, which is a misnomer, but that is what we think of it. But when people are also talking about masturbating outside of the relationship, if that's needed, like if let's say the wife is just really doesn't want to have sex very often and they agree to have sex once a week or once every other week, and she can do that, you know, with a really, I say to save her panini faute, with a really nice attitude and happy to do that, that's great. And then if the husband wants to have sex more often, for sure he should be masturbating if masturbating will make him feel better. And if the situation's reversed, if she feels like they're having sex once a week, but he is like uptight at this point and cannot seem to want to do it again, it's hard enough for him to feel like he has to perform once a week or whatever when they're scheduled, she might want to take a vibrator out and just pleasure herself sometimes with her own fantasies and her own fantasy life. Masturbating is a really, really important part of our lives. It shouldn't stop when you have a relationship. For some reason, it's really hard to talk about with our couple partners. I don't know.
The question goes a little bit deeper around mental health. And, you know, if you're separating from your partner and privately, where's the mental health that? Like, are you supposed to talk about it? Are you supposed to be open? Are you supposed
So I was just about to say, for some reason, it's very hard for us to talk about. I think of everything I've seen in couples conversations, it is, look, couples have a hard time talking about sex altogether, Ilana, in a crazy way. Like when you think about it, you're doing all these things together and you can't talk about it. It's kind of crazy. And, and people will often say, it makes me feel really uncomfortable. And I just laugh. I'm like, if you are uncomfortable, you're on the right track. Like, that's how you know you're right. Awkward is good with sex, right? Remember early on in your relationship when everything was a little awkward and scary? Yeah, that was hot, right? Everything kind of comfortable, not so hot, okay? So, you know, being awkward is not bad. It's just hard, okay? So, but for some reason, so in general, talking about sex with couples is just like, for a woman to say, I really want you to tie me up, or I want you to spank me, or, you know, or for the guy to say, you know, I really would like you to go down on me, or I want to try anal sex, or for some reason, couples have such a hard time doing that. So I'll often say, lights off, you're in the bed, try talking with me when you're not looking at each other. Like that is actually helpful and easier. But for some reason, masturbation is, I think it's because we have so much shame as a society about it. Like I can just tell you, I was going to say, how often do you think? But like, I'll just tell you, like, for a couple to say, for the husband to say to the wife, sweetie, I want to go masturbate. Like, that is just not part of our lexicon, right? I need to move to Norway because I'm guessing it is easier there. So I'm not sure that people need to say to the other person when and how exactly they're masturbating, because we're entitled to have like private things of our own fantasies, our own sex life too. We are entitled to that. But the idea that we do masturbate in general, that I think should be very acceptable. And if by chance you are comfortable enough to say, honey, could you please leave the room because I just need some privacy for myself, I would say, oh, you. Like, that's an amazing, amazing thing. And if we can get past this, like what I sometimes hear from women is when their husbands masturbate, they somehow feel like insulted. They're insulted that they're, and I'm like, do not be insulted. It is a totally different experience, right? It's just a different thing. And you know, you can have a conversation about it. Like if you feel like, oh my God, we haven't had sex in a month and you're masturbating, that makes me feel bad. Then I would say, let's talk about it. But if you're having sex at the rate when you're comfortable having sex and your partner still wants to masturbate because for whatever, it's stress relief, it feels good, it puts them to sleep. There's any number of reasons they may want to do that. And it's not getting away in the infertility treatment, because I know that sometimes too much ejaculation is a problem. Then I would say go for it. Masturbating is a normal, healthy part of your life. people's sexual desire and interests do not match up 100% all the time. And masturbating is just a really great, healthy way to respond to that. Does that answer the question, do you think?
I have a question. We have a question about the ick factor when masturbating. It can be smelly when you get wet and it feels wasteful. What can you say about that?
Okay, I also saw that there was a question about, again, the halachic issues of my husband's not allowed to masturbate. Okay, so let's start with that. I would say to you, try seeing if you can find a rabbi who is much more knowledgeable about sexual issues, because sometimes they will give permission when they realize it's putting a lot of pressure on the marriage and there's infertility issues going on, and the rabbis will sometimes come up with ways that make it better, or possibly with very limited access to you. So like, let's say the husband masturbates, but he doesn't ejaculate, except that he does that on your vulva, for example. That may also make it more acceptable. But I don't want to spend a lot of time on the halachic or the Jewish legal ramifications that you need to kind of discuss with your rabbi. The icky factor. So I'm trying to understand this. The guy who's masturbating doesn't like the goo on him?
I don't know. Please give a little bit more information for that question.
Well, what I'm guessing, can I guess? I'm guessing that there's sometimes women who don't like it when the guy doesn't ejaculate inside of them, right? Like if they're fooling around with their mouth or their hands, or the guy's masturbating.
Both.
It can be smelly, it feels wasteful, both. So I'm not sure about the wasteful thing, right? Because you wouldn't really want to have a baby come from every single ejaculate. We would be in bad trouble if we did that. So I wouldn't call it wasteful, right? A lot of sperm and ejaculate is being created constantly. So it's not in most cases, it's not like a limited resource. So I wouldn't worry about the wasteful piece of it. In terms of the smelly and that, I would say to you, first of all, in my experience, that you get used to it over time, right? Like anything else, you get accustomed to it. But you can, keep tissues, you keep wipes right next to the bed. And once the person ejaculates, you wipe it up. Or you take a soft cotton t-shirt or something and the man can ejaculate right onto that. Like there's things you can actually ejaculate on. You can use a really nice lubricant, which smells really good, which could make the whole thing smell and sort of feel better. Or don't put your face or your lips near the ejaculate if that is somehow unpleasant to you. Like be kissing your husband's face or his neck or his shoulders, or stroking, his chest with your fingers if that's what you're talking about, while he's sort of stimulating himself. Again, he can use a cloth or, a t-shirt or something so that the ejaculate actually gets, drips into something or squirts into something, as opposed to just, all over the place.
And then also the opposite. She feels like her husband says that she smells bad. Do you have tips for a woman as well?
So, yeah, I mean, again, this has to do, both your ejaculate and your vaginal fluid has to do with what you're eating. So there are things that although it's complicated, it's not it's not like you start eating pineapples. Like people often say, eat papaya and eat pineapples, and then your semen will smell better and the vaginal fluid will smell better. I would say that it's sort of a developed taste. It's kind of like wine, right? So, I would not suggest douching. So I just want to say that's not a good idea. Your vagina is a self-cleaning oven. You do not want to put unusual things there, but you can wash around the vulvar area with different kinds of smelling soaps and things like that. And you can take a shower or take a bath immediately before having sex if you think you're going to have oral sex and your husband's going to go down on you. And I would say that over time also that becomes something that people develop a sort of a taste for it, like that musky, it's a different kind of smell. It's just not a smell that we're used to on a regular basis. So, and sometimes people just don't like each other's smell. That you can't really, again, just don't put your face or your nose or your lips right where you may not like the smell. And that has to do with kind of developing a repertoire of activities between the two of you that you both find pleasurable. So, if you're somebody who really, your husband really doesn't like the way a vagina tastes and smells, or your vagina tastes and smells, you may not be an oral sex kind of girl. And if you really want oral sex, there are vibrators that kind of simulate that. Or you'll figure out other things that you really like that you can use that don't involve his mouth on your clitoris or his mouth on your vulva or vagina.
I see also in the question and answer section, we do have some additional questions. I mean, you've mentioned some, some things. What else can we do to have fun? Yes, the lying naked, scheduling sex. I don't know if that's fun. What are some other things we can add fun to in the bedroom?
So I would say use water, use the shower or the bathtub, play with water. I do really think this mutual massage thing is incredibly helpful. And might be a good time in your life to try this exercise, which I often will give to clients because I think it's fun and it's reconnecting. It's like learning to touch your partner. So you pick a specific time period. Let's say it's 20 minutes. Let's say it's 30 minutes. You cut it in half. So half of the time you're the giver and the other person's the receiver, and then you flip it. And at the time you start, the receiver just lies down on the bed with underwear, without underwear, with a sheet on top, a good temperature in the room, and the giver starts to stroke and touch the receiver all different ways. And the receiver's job is only to give feedback. And you're not worried about feelings. You're not having sex, right? So you're not worried about insulting the person. And that's your time to say, it would feel so much better if you used just your fingertips and not your whole hand. It would feel so much better if you used your tongue and not your lips. I would really like much stronger pressure down there. That feels really, really good. When you touch the upper part of my arm or behind my ears, that's really sexy to me, because we assume that everybody reacts the same and to sexual touch, and nothing could be further from the truth. Like, everybody's different. And so this is an opportunity, without getting defensive, without getting insulted, without anything, just to give feedback. And then you flip and you do it the other way. And I give this assignment to people to do different times because you change. Again, what feels good right now? Going through infertility treatments, your boobs might be a mess and you may not want your boobs touched. That is just, your breasts are just off limits right now. But heavens knows, your vulva is just so sensitive. And so when the fingertips touch the vulva or the inner thighs, it makes you feel great, or you may want much lighter touch than you wanted 6 months earlier before you started all these treatments. So, and I feel like at the end of that exercise and you talk, it just is very, very connecting. So that would be number 2. I will also talk a lot about sharing fantasies and, either watching some erotica together, if that turns you on, or listening to erotica. There's an app called Dipsy, which is actors reading their stories, their erotic stories. You could pick women on women, man on men, women on men, group sex, tame, less tame, all this, they're really well done. They're actors reading stories. They're sexy stories. So I highly recommend for a couple to start listening to that stuff together. It could be so fun.
What is that again? Emily, type that in.
Dipsy, Dipsea. So I should be sponsored by them. I speak about them all the time. Anyway, it's so funny. On my Instagram account, I do this Fantasy Friday, and because I feel like fantasy is the most important thing for us to reclaim. So Dipsea. She wrote S-E-Y-A-A.
Yeah.
I'm pretty sure, but somebody can just look right. I'm talking. The other thing I was going to say, and I totally lost my train of thought. Reading each other erotic stories. There's a website called Literotica. Every erotic story you could possibly ever imagine, written by millions of people worldwide. Search for anything that turns you on, school teacher, policeman, whatever turns you on, look for the story, read each other. Each of you pick an erotic story and read it. Even if you end up laughing, that's okay. Do you know what I mean? You want to make sex be fun, And then there's always I always suggest to people, get blindfolds and turn off the lights, get blindfolds, get naked, see if you can find each other naked in the room. The more playful you can be, the better. And the thing that I think gets in the way here is that it gets back to the fact that we have such a hard time talking about this. I think probably people listening would be like, what I'm supposed to say to my husband, I want you to look for me naked, blindfolded. He's gonna think I'm a deranged person. And I'm gonna say, yes, if it's uncomfortable, you're heading in the right track, because that often is what turns people on, right? And so you need to move out of the misery and discomfort of the infertility things and just move into a different plane of like awkward and uncomfortable and fun of your sex life. And that could be so healing to you. And that is such a incredibly healing, could be
Can
incredibly
I ask a quick question about that I see here? And then we do need to start wrapping this up. But I see one of the questions is a lot of the hormones that we take, especially as women, I mean, and men as well, other drugs, but it really affects with like our desire. So like you want to emotionally connect, you want to emotionally have sex, but physically, like you're just not there. So what do you do in a moment like this?
So that's such a tough question, you know, Ilana. And I really am like, I'm the hormone queen. You know, I really feel like fighting the lack of hormones or the too much hormones is really hard. It's like really hard. So, you know, and I always talk about that. Did I talk about my 17-year-olds in the movie theater line yet? I just feel like when you're in line at a movie theater and you see two 17-year-olds who can't get their hands off each other, you are not saying, oh my God, they must have had a really meaningful conversation, or oh my God, he must have really bought her beautiful flowers, right? You were saying their hormones are raging. Like we get that. We get that. So I feel like one of the most important things here is for people to acknowledge that. Like, yes, you are a mess right now. Your hormones are a disaster. And your hormones, not only are they not helping you, they may be fighting you. And that may be that right now you're gonna have to make a conscious decision that even though I don't really feel like having sex, I'm gonna have sex anyway because I like the secondary gains of it. And know that your hormones will one day return to normal. I promise you, right? Like, well, I guess I can't promise you, but probably, most probably, please God, when this is behind you in a bad memory, your hormones will get back to normal. And if you have been having sex regularly, it will be so much easier to keep your sex life going than if you just stopped entirely. So if you think you can have sex once a week, even though you don't necessarily feel that like you want to, but you know, use a vibrator because it makes it easier. Tell your partner, look, I'm not really feeling it, but if we turn on really nice music and we have a glass of wine and I get to spend a half an hour in the bathtub first, I think I could have sex in a really nice way. It may not be like me jumping you, but I think I could do that. And know, the most important thing to know is this is a road bump. This is not forever. This is not like a permanent stamp on your relationship. When this is behind you, your hormones will either go back to normal or you will come to me and I will help get you the hormones that you need, because we need hormones. And if you, I think you raised earlier, guy with low testosterone. Did you raise that? Yeah.
Yes.
And we just kind of flew by. Giving men testosterone is like a no-brainer. It's safe, it's important, and like it helps with erections, it helps with desire. It's like a light switch for the men. For the women, it's like a dimmer, like it moves things up. And it is hugely, hugely important. All of these things can be fixed. Sometimes you can't do it now while you're going through the infertility. Sometimes right now you're going to have to just say, you know what, I'm going to do the best I can right now. I'm going to keep things going as best I can, even though it may not be 90% even. I'm only get it to 60%. But at 60%, it's much easier for me to get it back to 90 when this is behind me than if I let it go down to 0. So does that make sense, Ilana?
1,000%. 1,000%.
Wait, somebody asked, I have to say this, is it realistic to get naked with a spouse and have him not be? That goes back to the scheduling, not scheduling. That goes back to a conversation. Exactly. If you have decided that your sex day is Sunday and the rest of the week sex is off the table, then it is 100% realistic to be able to get naked with somebody. And if you don't have that kind of schedule, but you right now feel like you want to get close, use your words. Sweetie, I really, really want to get naked and cuddle up with you. I do not want it to turn into sex. Can we have it not turn into sex? Because we had sex yesterday and I don't want to have sex again today. We need to be clear. Clarity is where it's at, Ilana. Like, that is it. I will now shut up.
We love you. I think you're amazing. I wish I knew you 12 years ago.
But you know me now.
I do know you now. Seriously, I hope that this has helped the group that was with us tonight. You guys have been great. We're gonna leave you guys with an assignment. Do you have an assignment for us tonight?
Me? Do I have an assignment?
Yeah, let's leave it with a project. Is that what you meant? Let's leave one assignment.
Yes, one assignment. Okay. This is your assignment. Tonight, I want you to talk to your partner if you have a partner. I want you to express with your partner like what you're thinking is happening. I know this is going to be really hard, and I want you guys to set a goal for what is the first thing you want to try to do with your sexual relationship. Can I give 2 assignments? And then I want you to give a date for the next conversation you're going to have about it, so that it doesn't become one of those unspoken things that sits on the shelf and just sits and sits and sits. And for some people, that will be like a code. When I say, you know, Johnny and Jenny, we need to have a conversation about sex.
Yeah.
Or for some people, it'll be like, can we do a check-in on, you know, Sunday mornings to sort of see where we're at and kind of see where we want to take it. Maybe we want to make an appointment with a sex therapist, whatever you want. I do want to tell people that if you want more information, our website, Maze Sexual Health, we have Maze Women's Health, Maze Men's Health, Maze Men's Infertility, tons and tons of information about all of the stuff I talked about. And you can follow me on Dr. Sheva at Instagram or Facebook, so I put out posts. But if you want information, absolutely go to Maze Health. And the truth is, now with Zoom, we're taking on therapy clients from far away, which we never could do before. So there are great resources out there, guys. Use them. Your sex life is worth it.
Amazing. Thank you. I'm inspired. I would like to ask all of you to please fill out our post-webinar survey. We want to make sure, I mean, it sounds like this was a good one just by the comments we're hearing right now, but we do want to make sure we're continuously meeting your needs as our amazing audience and followers. Continue to follow us at Dr. Sheva and at Jewish Fertility Foundation. And you can check out all of our upcoming virtual events and well, we're not doing in-person events right now, but one day soon. Have the best amazing sex you can have, and if not, we have Dr. Sheva Marcus here to help us.
Can I come back when you have real events? Can I fly down to Atlanta?
I would love to. That would be amazing. Thank you. I want to meet you in person one day. Absolutely.
We totally will.
Thank you so much.
Kisses.
Have an awesome night. Laila Tov. Good night.